Good afternoon. My name is Paul Edwards. We're grateful that you can join us for this afternoon's briefing about the COVID-19 crisis. Today we'll hear first from the governor, from Governor Gary R. Herbert. He'll be followed by state epidemiologist Dr. Anegla Dunn. Then we'll hear from Byron Russell, who is the co-chair of the Utah Multicultural Commission. And then we will hear from Natalie Garner, who is the director of the Gardner Policy Institute at the University of Utah. So we'll hear now from Governor Herbert.
Well, I hope so. Thank you, Paul, and thanks to everyone for listening in today. We welcome you all here, particularly mindful of the press and the opportunity we have to, in fact, address the state and give them an update on how we're doing with this pandemic. So welcome and thanks to everybody for their cooperation and participation. We're doing very well as a state, and I'll talk about that maybe in a little bit. Benjamin Franklin once said a familiar phrase that most all of us have heard, that is, if you fail to plan, you're planning to fail. And I want to add to that Dwight D. Eisenhower, former president, who said, if you haven't been planning, you can't start to work intelligently, at least. The good news for the people of Utah and for all of us is that from the very beginning, from the outset of this pandemic, we've brought together the best minds, the brightest and best people we have, whether it's in science, in medicine, and data analysis, working together to develop the most comprehensive plan in America, as I've said before. And the good news for all of us is that because we've had this plan, which has given us a pathway forward, a road to travel that will get us from the pandemic to, in fact, recovery and success economically and protecting people's lives along the way as well as their livelihood, is in fact working. The plan we have, which we call Utah Leads Together, has been a dynamic plan, meaning that it's subject to change as new information comes in, as we have new data, as we have new circumstances and situations and opportunities as well as frustrations. We're able to, in fact, modify that plan so that it's dynamic and really addresses the issues as we see them today. Now, we expect that tomorrow there'll be some more information and we'll have a different iteration. We're going to talk today about, in fact, our third iteration, which we call Utah Leads Together 3.0. The first version that we had, as you recall, was designed to take us from the urgency phase, the red phase we call it, and move from urgency into a more stabilization area phase. And again, we've done that in remarkably good time, where we once thought it would take 8 to 12 weeks to get that point of stabilization. We've done it in 5 weeks. That's a credit to many people, the people of Utah following good guidelines and common sense application of their hygiene needs, social distancing, wearing of the mask, those kinds of things, which have helped us to get to the point where when we moved into version 2, because of the good foundation was laid, most of Utah's cities and counties now are, in fact, moved from our high risk to moderate risk, and now from orange to yellow or low risk. So again, these plans have helped us, as I mentioned, have a pathway forward of what we need to be doing and how to do it to get into, in fact, full recovery. I'm pleased to announce, too, we've mentioned before that we've gone from moderate to low risk, from orange to yellow, as we color code these economic indicators, that we've been approached now by Summit and Wasatch counties, who've approached us, and they like the trends. The data that they have would substantiate the need for them, or the opportunity for them, in fact, to move from orange to yellow, from moderate to low risk. And so our health department now is analyzing that request. The trends, the numbers at least look good to us. There'll be some analysis on that, and we would hope that there's going to be an opportunity for us to move Wasatch and Summit County to the low risk stage, the yellow risk here, by the end of this week. So that's some good news of additional progress being happening around the state, and we appreciate the work of Summit and Wasatch County to get to this point. Really, we've had what I would call unprecedented collaboration. It's been private and public working together. It's been government to government, state to local governments. The federal government certainly has had a role to play. Some of the funding sources to help businesses and employees and employers stay afloat during this difficult time. And really, at the end of the day, to help slow the spread of this coronavirus. By us flattening the infection rate, we've been able to save lives. We've been able to slow down the spread. Our healthcare resources have not been overwhelmed. We have an abundance and capacity there, which will help us as we go forward if, in fact, we have a surge, which certainly is a possibility with the pandemic. We'll have the ability, in fact, to address that surge and manage with our health care professionals. So I feel very good about where we're at. Now, let me just mention, I recognize that many have passed away because of the COVID-19 virus. And our hearts break for those loved ones, the people out there that have passed away. And we recognize the challenge that we've all faced because of the pandemic, our lack of being able to associate together. But for those who've passed away in particular, Utah mourns with you that have lost loved ones, friends, and family. We are very concerned about the vulnerable populations. We have a disproportionate amount of people age 65 and over that have passed away. 70% of the people who have passed away are over 65. 90% of them are over 65 that have passed away and have underlying health care issues. And we're going to hear from Dr. Dunn here in a little bit about that issue and what we ought to be doing and what we can be doing to protect those who are vulnerable and more susceptible to severe reaction to the COVID-19 virus than others and what we can do about it. I know that there's a lot of fear out there in the marketplace, and our obligation as the state is to make sure you get accurate information. More and accurate information will help us, in fact, stem fear. People are feared for life. They're feared for their livelihood, their job opportunities. That's the number one concern, I think, of the pandemic now is what about my job and economic recovery. So good and accurate information, thoughtful planning, which is what we're doing, will help us alleviate the fear. I certainly believe that if we are prepared, there's no need to fear, and we can go forward really with confidence that what we're doing is paying off in positive ways for us to recover from the pandemic. So that brings us up to version 3, which we're going to have today and introduced. Again, version 3 builds upon versions 1 and 2 as we plant the seeds for recovery and develop a pathway forward. Our new comprehensive plan will in fact help assist populations that are disproportionately impacted, as I've mentioned, our high risk areas of vulnerability. Again, Dr. Dunn will talk about that, as well as our need to address our multicultural issues out there with some of our highest infection rates are in our minority communities, particularly Latino and Hispanic. We're concerned about that, and those will be addressed, and Byron Russell will talk about that in a few minutes too. Utah Leads Together 3.0 does not mince any words about the overall economic challenge that we have faced and are facing still today. But there's good news out there. I think there's reason to be optimistic and reasons to be hopeful. I think version 3.0 offers a bold vision of what we can do to, in fact, accelerate our economic opportunities as we go forward. It will help us drive our steps of what we need to do, in fact, to open up the economy. And I believe at the end of the day, we'll be as good as we were before, maybe stronger and more able to face the challenges of the future than ever before. So there's reason to be optimistic and hopeful. I'll just mention a couple of statistics which might be meaningful. One, the Pew Center, a think tank out of Washington, D.C., and doing an analysis of the states, said that Utah is best positioned of any state in America, along with Minnesota, to be in a situation to last and persevere and come out ahead this pandemic. Part of that's because of how we have saved for a rainy day. Our rainy day fund are full. We have stress testing for our budget, one of only three states in America that do it. So our budgeting processes have been good and prepared us and put us in a pathway where we can survive through this pandemic better than about any state in America today. So we start in a good place. And just recently here, just a few days ago, Forbes magazine put out a review by Moody Analytics on Wall Street and named the top 10 cities in America ready to, in fact, recover, those who are best positioned. And they mentioned Salt Lake City and Provo and their metropolitan areas, which, as we know here in Utah, that really goes from Ogden down to Payson on the south, really the Wasatch Front. So it's good to know that others outside of ourselves are feeling that same kind of optimism that I'm feeling here in the state of Utah as we start to move into stabilization and on our way towards recovery. Just in the last week, actually maybe a couple of weeks, we've had no fewer than seven companies who have agreed and are in the process of expanding their operations in Utah in the midst of this pandemic. That accounts for about 3,665 new jobs coming to Utah. So even in these dire circumstances, we see the fundamental foundation we have of economic prosperity and opportunity, and our free market system is still alive and well. And those fundamentals put us in a place for a good recovery. I'm bold enough to predict, and I know we'll have numbers coming out Friday, so we'll find out if my prediction is true. I have a sense that our unemployment rate will be lower than the national average. I think we'll be pleased to see in comparison that we're doing much better economically than most states in America. That doesn't mean it's time to spike the football or declare victory, but it does give us assurance and with confidence that we can move forward, that we're going to have a positive outcome, not only in protecting people's lives, but as I say, protecting their livelihoods too. So again, a lot of good news in the messages today, and I think we're going to see that hold up as we start looking at economic revival that's taking place here in the state of Utah, as we get through the stabilization stage in 3.0 and move hopefully in the next few weeks into complete open recovery mode. So with that, we'll have the opportunity now to have Dr. Anegla Dunn come and speak to us about protecting our high-risk populations. That will be followed by Byron Russell, who will talk about safeguarding Utah's multicultural community, and then Natalie Garner will give us a brief on 3.0 and what we're doing to plan for economic recovery. Following that, we'll take some questions from the body for the group that's up here, so we'll all stay tuned. All right, thank you, Dr. Dunn.
Okay, so first I will start out with just a quick overview of our numbers, and then we'll talk about high-risk populations in a little more detail. So today we have 7,710 cases of COVID-19 identified in Utah. That is an increase of 192 from yesterday, or a 2.6% growth rate. We've tested approximately 180,000 Utahns for COVID-19, an increase of 2,353 from yesterday, and we have a 4.3% positivity rate overall. Unfortunately, we do have 2 additional deaths to report from yesterday, so we have a total of 90 deaths due to COVID-19 in Utah. Both of these individuals were between the ages of 60 and 85 years. One was a Salt Lake County resident and also a long-term care facility resident. The other was a Utah County resident, and it's currently unknown whether this person was hospitalized or in a long-term care facility, as the investigation is still going on right now. So today I want to discuss those who are at high risk for severe disease due to COVID-19. And first, I think it's very important that we all understand what makes an individual at high risk for severe disease due to COVID-19. Those characteristics include being over the age of 65 years old, living in a long-term care facility, or having a serious underlying medical condition, including being immunocompromised. Second, I think we all need to recognize that it's all of our responsibility to prevent the spread of COVID to these high-risk individuals. Actions that we should all be taking include wearing a mask when social distancing is not possible, staying home when you're ill, using really good hand hygiene, and even helping those high-risk individuals be able to stay safe and healthy. This could include going to the grocery store for them, picking up their medications, or bringing them a meal. Third, if you are at high risk for severe disease due to COVID-19, it is really important that you maintain strict social distancing. Good hand hygiene is also very important, as well as regularly cleaning high-touch surfaces in your home. It's also important for those at high risk for severe disease to try to stay out of public places as much as possible. We're doing everything we can to get Utahns back to work quickly and safely, but it's really important that we continue to take actions to protect those who are at most risk for severe disease due to COVID-19. Thank you. All right, Byron.
Thank you, Dr. Dunn. I stand here today on some pretty tall shoulders, and I just wanted to make some thanks to those individuals who are really the reason that we're here today focusing on multicultural issues in our state during this crisis. And I start, of course, with Governor Herbert and Lieutenant Governor Cox. As we looked at what we're doing in this community, we realized that our state is well ahead of a lot of other states in addressing our multicultural communities more than a lot of other states are making that effort. And I just wanted to thank them for their great support and their resource to help us to get to this point and to allow us to do a lot more work in the future. And I also want to thank Natalie Garner, who you'll hear from, and is one reason why we are able to articulate and describe and promote our needs in this community. And I really do think that you'll be impressed with the work that some of us have done. And that is, of course, our Utah Multicultural Commission, which has existed to provide a resource and a structure to leap into action to create our newly formed Utah Multicultural Subcommittee of the COVID Task Force, as well as some of the working groups within that task force, which I'll talk about. And then there's also our resource task force resource groups that we will soon be unveiling to you. And of course, some of the tallest shoulders was my co-chair, Zeman Zhao, and the Multicultural Affairs team led by Nubia Pena, which includes Claudia, Jenny, Rosanna, Ephraim, Joel, and I think I got them all. I know there aren't that many because they work so hard, but also my quiet heroes, and that would be Kristen Rappley in the Lieutenant Governor's office and Jill Love. Utah Leads Together 1.0, 2.0, 3.0 truly saves lives and livelihoods. However, the data demonstrates that this pandemic is not impacting all Utahns' lives and livelihoods equally. In fact, we are aware that Utah has a population of the Hispanic Latino community 14.2%, and that makeup is contrasted by those who are affected at 38.1%. And we also know that there is a large incidence with our Pacific Islander communities, Black and Asian as well. You know, I do have optimism for our moment. And I ask three things on behalf of our subcommittees and all of the work that's being done of Utahns to lead together. One, learn the facts of disparities. You can read this in the Utah Leads Together as a start. It's a very good document that documents some of our concerns. Two, address immediate needs. And as it lists in the Utah Leads Together, it advises us to follow public safety guidelines, to stay engaged with the economy, and to assist those in need, as Dr. Dunn just listed for us. And then the third is to really help us build a structure to fix the systemic disparities for a lasting, equitable prosperity. And I say that because we have, while we have addressed the specifics of our priorities, truly the pandemic stresses and the exposure of these systemic vulnerabilities have been noted in the social determinants of health. And frankly, the social determinants of health is a very learned and academic exercise, but essentially, until recently, it's become reality and tangible to our affected populations. And so that is important to think about how we systemically fix that issue that has always plagued us and does now and will in the future if we don't use this opportunity. I won't go over the detailed subcommittee priorities, but you can read those in the report. But I will address the specific needs identified to address our concerns. And they include, and certainly there are more, but digital divide, food insecurity, misinformation, the governor spoke about, limited English proficiency, access to healthcare services, lack of culturally inclusive messaging, increased incidence of domestic abuse, homebound with disabilities, and housing insecurity and fear of eviction and fear of deportation. These particular issues are being taken up by our work groups, who I have to say are just extraordinary individuals who volunteer their time on top of what they do all the time in their daily lives. And these subgroups are language access, led by Zeman Zhao, social services and housing, led by Asha Paresh, and economic sustainability, led by Sylvia Castro, communications, led by Juan Becerra, digital equity by Denevia Knight, health equity by Dulce Diaz, and food security by Selena Milner. So one of the things that we are discovering is that you really can't take talk or these ideas or this work to the bank. We will need resources, and as these resources will be required to meet those needs and priorities to narrow the gap of disparities. And we will find our working groups to advise the subcommittee of needed budgetary resources to bring greater equity in lives and livelihoods. Stability phase, we all talk about, and it's something that I think our state has brought us awareness of. And as we think about returning Utahns back to work, that becomes topical. Unfortunately, sometimes it becomes political. But I think it's really important for every Utahn, and not just our multicultural communities who we speak to realize that the way that we can get closer to work is to think about the things that you hear at these press conferences and the health concerns that we need to follow. But mostly, restarting the economy will require that every Utahn plays a role in Utah's recovery. And with that, I thank you for your time.
Thank you, Byron. Thank you, Dr. Dunn. Thank you, Governor. My name is Natalie Garner. I direct the Kempsey Gardner Policy Institute. I'm also the lead for the Economic Response Team's policy team, and I've been asked to share some information about version 3 of Utah Leads Together. I want to thank a lot of incredible people that have helped compile version 3, including representatives from Economic Development Corporation of Utah, the Salt Lake Chamber, Governor's Office of Management and Budget, and a variety of business and community leaders. I hope you've all seen and have access to this incredible volume. Most of you will remember that Volume 1 of Utah Leads Together introduced the economic phases, urgent, stabilization, and recovery. That was the main contribution of version 1. Version 2 introduced the color-coded health guidance that's been so instrumental in reactivating the Utah economy, to do that safely. And now version 3 really does 3 things. It helps us understand how to triage risk for high-risk populations. It helps us to know how to safeguard our multicultural communities. And then third, helps us plant seeds for a full economic recovery in our state. And I would like to really emphasize 3, which is the economic recovery. And I'll do that by just highlighting a few things. First, our state entered this crisis very well economically prepared. We know that because our unemployment rate was at its lowest level in state history. We had come through the longest sustained economic expansion in state history and have one of the most well-diversified economies in America. Because of those advantages, our cumulative jobless claims as a percent of the workforce tally 9.6% today, a really high number, but pales in comparison to the US average of 21.5%. Even with this, it's a troubling number, but we have done fairly well. Unemployment claims have declined now for 5 consecutive weeks, and it's the consensus of the state economic community that we will begin to have job increases again within the next 30 to 60 days. But let's be clear, this is a massive economic challenge. We'll have upwards of 100 to 200,000 Utahns unemployed that we need to swiftly get back to work. It's an economic body blow, and the economy has changed in the process. The Economic Response Task Force recommends that we recover to better. That is, to take what we have and get to an even better place. We are recommending 5 principles of economic recovery. The first is speed. We have to address these challenges quickly. The second is that we be targeted by industry, and by geography, and by occupation, so those that are of greatest need get the help. We want to be flexible. That's because the virus presents significant uncertainty. We don't know what the months ahead look like for sure, so we need flexible policies. Fourth, we want to look for things that provide a permanent benefit. That is, what are the investments we can make now that not only help us in the short term, but help us arrive at something better in the long term? And then finally, innovative. Now's the time to do things differently. We have segmented the response into 3 areas that I'll highlight. First, Utahns who have been furloughed. These are people who are job attached, and they represent 70% of the unemployment claims. We can make progress with this population quickly, and the most important thing we can do is follow the color-coded health guidance that returns this economy to normal, which allows these employers to bring back their valued employees. I will also add that the assistance fund from the CARES Act and other resources are very helpful in helping the furloughed. Second category is those who have been laid off, those who become part of the continuing unemployment claims. In this case, we have to make some investments as a state. And in Utah Leads Together version 3, we recommend 2 types of investment. Training-ready investments in our institutions of post-secondary education. That would include short-term certificates, 1-year master's programs, and technical education that can quickly retrain and get people ready for these new jobs. And then the second would be construction-ready infrastructure investment. We have a lot of infrastructure needs in this state in transportation, water, outdoor recreation, broadband. Let's accelerate those. Do them now so that we can get these laid off workers back to work. And then finally and lastly, in our thinking about how we plant seeds for recovery, we're very interested in macroeconomic trends that have changed. The supply chain has changed. Remote work and remote learning has changed. Our interest in food security has changed. So we want to identify investment options for the state that get us to recover to better. I'm fond of Fred Rogers of Mr. Rogers' Neighborhood. He said, sometimes when you think you're at the end of something, you're actually at the beginning of something else. And I would just say that the Economic Response Team believes we're at the beginning of something new and better for our state. Thank you so much.
Well, thank you, everybody. I want to say, Natalie, won't you be my neighbor? We have great neighbors here in the state of Utah, and really the success that we're having in Utah is reflective of the people of Utah for their goodness, for their desire to help their neighbor and to follow good common sense directions and put us in a good place. So with that, we have the 4 of us here. We're happy to answer any questions you may have for a few minutes. So we got any questions?
Governor, it's Ben Winslow from Fox 13. Can you address what your timetable is to potentially move to a green level on your color-coded risk scale, and how long we might still be in yellow, given that we've seen some case increases in recent days, and the curve does not appear to be flattening as much as maybe some had hoped?
Well, of course, our hope is as fast as possible. I'm going to have Natalie come in and maybe address the economic aspect of this and the data. But we'd like to do as quick as we can. At the same time, we do not want to jeopardize the progress we've made by having an untoward surge of the coronavirus in our communities. So the data is what's going to inform us of what to do. I've mentioned before, this is not going to be driven by fear. It's not going to be driven by politics. It's going to be driven by science and medicine and data. So, Natalie, would you like to come in and give us your opinion on, as an economist and probably involved in this as much as anybody, what your crystal ball says?
Happy to do that. I mean, I would just mention that the real key in version 3 of Utah Leads Together is the very strong recommendation that this state triage risk to separate low risk from high risk populations. As we do that, if you can keep the high risk population safe, you can have the rest of the population doing more things that enables us to be at green and have an economy that returns to normal. I'll just share a couple of data pieces from the report. It mentions, and Dr. Dunn may want to comment on this, but it mentions that 70% of those who have passed away are 65 years and older, and 90% plus of those who have passed away are 65 years and older or have other medical conditions. And this makes the very important point that if we can really emphasize Utah's high-risk population, that will allow us to get to green more quickly.
And Dr. Dunn, please address that as well, about any kind of timeline or how we are on the curve.
Sure. So in the recent weeks, we've been kind of going between a little bit of a plateau and then some instability in terms of increases and decreases over the days. So we're working with each jurisdiction to identify kind of where they are specifically so that we can work with the specific local health districts on policies related to that geography, rather than having kind of one blanket approach that might not work for every jurisdiction. So that's where we're at today in terms of looking at specific geographies and their metrics and making recommendations from a public health perspective that way. So in terms of timeline of going to green, I mean, I just don't have that on me right now. Our data currently don't support it, but again, we're looking at that every day and evaluating, and things, as we know, change so quickly. So.
And Ben, we will let the data drive us. Again, we originally thought it was going to take us a lot longer to get to where we're at today with low risk, and mostly yellow. We still have some areas that we need to work on, and we're concentrating on and working in collaboration with local governments to address those hot spots. But I hope we're surprised again. I hope we do this quicker than the next 8 weeks, which would take us to get to at least what we would estimate to get to a green state. And I also mentioned something. I just got off a phone call with the National Governors Association, and the governors, we compare notes once a week on how we're doing in our respective areas. And it just reminds me that we're intertwined. We're intertwined here in the state. I have 29 counties, 245 cities, all working together to create our GDP of this state. We're also intertwined with what happens in surrounding states and throughout the country and throughout the world. And so we hope that every area has improvement, because that's going to help us to improve in our own state. We asked the question that today with some of our larger CEOs that were on the call with us. We have opening here in Utah, but at some of our malls, some of the national firms are not opening up. And we asked the question, why? Is that because of a fear of safety, of the spread of the coronavirus? Or is it a concern that we're not having enough foot traffic to come in at this present time to justify the economics of opening up a store? And we had mixed responses to that question. So it shows how we're kind of intertwined. And again, we're at the lead end, I think, compared to the other states. But all of us working together, I think, is going to help us to have a quicker recovery than some maybe have been predicting. Next question.
Hi, Sonia Hudson with KUER. With this focus on protecting high-risk populations, how do you keep high-risk populations safe if they live with low-risk people who are, re-entering normal life as we start to open the economy up?
Okay, Dr. Dunn?
I think that's why it's so important that we recognize that the way high-risk individuals get infected is from low-risk individuals. So it's up to all of us to really protect ourselves against coronavirus, especially if you live with someone or take care of someone who is at high risk. Those individuals need to be specifically aware of, good hand hygiene, not being around high-risk individuals when they are feeling ill, and really protecting themselves against getting COVID because they're so close to high-risk populations.
I'm going to have Byron come in here and talk about, again, high risk, some of our cultural situations, whether it be Latino, Hispanic, Pacific Islander. So Byron, could you talk about that?
Thank you, Governor. When we look at the stats, and I think our economists will let you know, and I don't think it's very difficult to find, that a lot of those who are at risk are really now what we call on the front line. And they happen to be members of our multicultural communities or minority populations. And I think it's somewhat apparent and pretty much obvious that a lot of these folks have 2 or 3 jobs. And so when some of them don't have the luxury of staying at home, just the idea of having 1 job and going out and not staying home, and having 2 or 3 jobs and having to go out, your risk becomes even higher. And so our multicultural communities are looking at workforce situations. They're looking at ways to make sure that those who are most exposed are getting treated, they're getting tested, and working with our partners, Intermountain Healthcare, we are specifically targeting these various communities in different counties. And the word has to get out to those communities that we're trying to test and the communities who we're trying to protect. Sometimes a broad-based alert or press release of somebody going into Utah County or to Summit County doesn't necessarily achieve that option, because there is, first of all, the entire community who goes, and there are also stigmatisms that are brought to the forefront, because a lot of our minority communities are concerned about the stigmatism of getting a test or being in a line for food security issues, and that in itself is heightening the problem as well.
Next question.
Hi, Governor. Tony Semerad with the Salt Lake Tribune. Does the state intend to renew the Test Utah contracts at the end of this month?
All of our testing contracts are under review. Testing has been the biggest challenge probably the nation has faced. Again, I was just on a conference call with the other governors, and we were on a conference call with the president and the vice president here just a day ago. And testing continues to be a reoccurring issue. We'd like to have more people tested. We have the capacity of 9,000, yet we're only doing about 4,000 here in the state of Utah. We're concerned about not only having more testing being done, but the accuracy of the testing, which again is a national issue. So Test Utah, along with others, are under constant review, and that's yet to be determined. We appreciate the fact that people have stepped up and said, look, we have an idea, we have a plan, we have maybe a technology that will help us. The assessment aspect of Test Utah has been very well received and has been very helpful. So we'll have to wait and see what happens in the future.
Thank you so much. This is Chris Reed with St. George News, and I have a question for the governor and a question for Dr. Dunn. So first for the governor, from the Southern Utah perspective, you mentioned about spiking the football earlier. If you go into at least the markets here, you don't really see people wearing masks too much. There's even a protest scheduled for tomorrow, and a lot of people have looked at this as that we have gone back to normal. Do you have a message for people who would say everything is back to normal, just go about your normal business at this point?
Well, the simple answer is we're not back to normal. And I'm not sure that we'll ever get back to what we thought was normal. We might have a new normal. You hear that phrase all the time. have Natalie come in here and maybe add some of the economic aspects of this. We're in the middle of an emergency still. Again, we're not in recovery. We're starting to get to that point. Natalie mentioned that maybe in the next 30 to 60 days, we'll see the curve turn where we start growing jobs as opposed to losing jobs. I hope it's even quicker than that. All of us have a responsibility to do our part. These plans and the orders and the directives don't work if people just ignore them. That just creates more chaos and more problems. We have people that were using the mask as a protest symbol. I don't have to wear it, and that's true. We don't have a law that requires you to wear it. But if you care about yourself and if you care about your neighbor, which you should care about, when you go to retail outlets, you ought to be wearing a face covering. That helps protect you against the spread of the droplets that may happen in the air if somebody coughs or sneezes or just talking. And it also protects them from you in case you happen to sneeze or cough and spread droplets out there. Some studies estimate that we will reduce our transmission rates by 70% if we all were wearing face coverings, at least until we get a vaccine and the ability to inoculate ourselves and protect ourselves against this. So I know it's inconvenient, but it's probably the right and proper thing for us to do. When I go out shopping, whether I do grocery shopping or wherever, went into Lowe's the other day, a lot of the people were wearing masks when I was there. So I hope all of us are kind of getting on the bandwagon of saying we ought to have a responsibility as a good neighbor and a good citizen. Mentioned Fred Rogers wants you to be my neighbor. We ought to have a responsibility to do what we can, at least our part. It's a simple thing to do. And I think more and more are catching on that that's the right thing to do, but we're not back to normal. Natalie, have you got anything economically you'd like to add to that?
What I would add is that there is a lot said about this being an economic crisis, a lot said of it being a health crisis. If you really dig below that, it's really a crisis of confidence. You know, if you're not confident that you're going to go out and be safe, you're not going to go out. If you're not confident that by dining in a restaurant or shopping, that you're going to be safe, it doesn't really matter what government says. It's really, how do you feel about your public health? Are you confident? And the same thing in economics. You know, you're not going to do things, you're not going to make purchases, you're not going to engage with the economy unless you're confident. So the economist in me would just say that the linkage between following public health guidance and being to a new green or a new normal is very tight. And the best thing our state can do is follow public health guidance and stay engaged with the economy. And as we do that, we will continue to recover more quickly than other states.
Dr. Dunn,
Thank you.
a question for Dr. Dunn?
Yeah, thank you, Governor. And Dr. Dunn, good to see you again. And quick question concerning on the basis of rising cases in southern Utah. There's been more than 30 new cases in just the last 2 days, by all appearances. I've heard a difference of opinion from medical folks. Some say this is purely testing, that because there's more access to testing, or more tests, that's why there are more cases now in southern Utah. Is that purely the case, or is there something that southern Utahns need to watch here as far as the rising amount of cases?
Yeah, so we were actually just reviewing that data this morning, and it doesn't seem to be, the increase in positives does not seem to be linked to the increase in testing. We're actually seeing an increase in the % positive there as well. So it is, we have worked with the local health district, and it is kind of that point where we're asking the community to be a little more diligent in terms of social distancing recommendations and following public health guidance, because there is the potential for a surge in southern Utah at this point.
Okay, the last question.
And just to follow on that.
Hi, Governor Herbert, this is Roger McDonough with KCPW Public Radio. Natalie just mentioned following common sense public health directions and how following that guidance will help us with a faster economic recovery. As you know, there's a group called Utah Business Revival, which is planning on holding an event in Kaysville in about 10 days. It's supposed to feature a country music star. It has the support of the mayor there. Under the yellow level gatherings, the yellow level, whatever it is, the risk level, the gatherings are supposed to be limited to 50 people. It seems almost certain that more people will be there than that. You have said that it's the role of the county to enforce, any COVID-19 orders. But you also just said that we're all intertwined as counties, and as a state. And, I'm just imagining that a lot of people could come from other counties to see Colin Ray perform. And I guess my questions are, what is your opinion of the event itself? And then given the potential impacts of larger gatherings like this one, is there anything that the state should be doing, say on the enforcement side, beyond conveying these public health messages?
Well, I think with the strict reading of what we've proposed under yellow, there actually is the ability to have a larger than 50-person gathering at an event. But it does presuppose and requires that you follow certain social distancing requirements, screening of people that come to the event, wearing of having hand sanitizers, wearing of a facial mask, and taking the protocols that are necessary seriously to put on the event. If that can't be met, then it shouldn't happen. That's the responsibility of the local government officials, which we've always wanted to be involved in any of these discussions. And sort of the mayor and her council need to, in fact, have that discussion with the local Davis County Health Department in conjunction with the state health department. If protocols can be met, then the concert could go on without any complaint. If they can't be met, then they need to find something else to do or another way to do it. So what we don't want to send is an uncertain signal and a message out there. We would expect cooperation and collaboration. They're just, finding a way to do it is probably the right terminology as opposed to finding ways that we can't do it. But I'm a little disappointed that there's a lack of cooperation and a spirit of let's find a way that everybody can agree to put on this event as opposed to, this is some kind of a protest. Utah's been ranked in the top 4 or 5 in the nation as having the least amount of restrictions in the nation today. So I don't know what the message is they're trying to say, because we're doing pretty well as far as we've never really shut down the state like many states have done. We're pretty open, and we're getting more open all the time. And we're doing it by finding the appropriate balance of what's necessary to protect people's lives, to slow down the spread of the coronavirus, to address those who are most vulnerable in the population, and also open up gradually, incrementally, as we've talked about, the economy and provide opportunities to go back to work and have jobs. But again, I can tell you this will not work. It'll all be for naught unless people participate and cooperate and engage appropriately, following the guidelines that have been put in place, not by willy-nilly or pulling out of the sky. This is by deep dive analysis and recommendations from very smart people in science and medicine, our data analysts working as part of that. We have a plan going forward. We would hope people would in fact embrace and support and say, yeah, let's do it the correct way. So I hope that's what happens. Let me just conclude there. I think we're done with our time today, but again, a lot of good news today. We see a couple of our counties moving from orange to yellow in the next few days. We see the economy opening up. 3,600 new jobs that have just are coming to Utah in the middle of this pandemic. Opening up of our economy is really at the forefront of people's minds. And people, I appreciate Natalie talking about the confidence level. You've got to be confident about where you go, that you're not going to have fear of getting infection, getting the coronavirus, and not fear that we're going to not have economic opportunity and jobs. So it really is a balancing act that all of us have a role to play. No matter who we are, we have a role to play. So I say to the people of Utah, be grateful for the successes we're having. A lot of it has to do with you and your behavior. Stay strong in our efforts to, in fact, follow this new plan, this new dynamic plan, which is going to lead us to a great outcome sooner than other states. I can promise you we'll recover faster than any other state in America today. Again, we'll look for the numbers. The unemployment rates will be coming out this next Friday. So we'll see how we stack up. It'll give us a placeholder where we're at. I'm here to predict we're going to be in a pretty good place, which would give us optimism and confidence and hope to move forward into the future. Thank you very much.